Have you ever been diagnosed with anxiety, depression, or premenstrual dysphoric disorder? If you have, and you've been prescribed antidepressants, and you find that you have been on and off antidepressants for the majority of your life, then you need to watch this. So I have been diagnosed with all three of these. Obviously, anxiety and depression is pretty common. People know a lot about it. But PMDD, it's basically severe form of PMS, which happens 1 to 2 weeks before your period is due. So basically, pretty much half of your life, you are depressed and down. During the past 12 years, I'm now 31, I have taken fluoxetine, citalopram, sertraline, and none of these have worked for me. I have found myself periods of about 5-6 months, probably max, that I'm taking these antidepressants, and then I realise that they're not really working, and then I stop taking them. Well, when you are due on, this can exacerbate ADHD symptoms, which often can lead to that misdiagnosis of PMDD. I have never been able to take any sort of hormonal contraception. It doesn't agree with me. It causes severe fluctuations in mood, and it just, I can't take it. It is so common for women to get misdiagnosed when it comes to ADHD. People with ADHD lack dopamine, which makes you happy. So, of course, we're going to present symptoms of depression and feeling anxious because we're not as happy as everyone else. Naturally, we're not as happy. If you can relate to what I'm saying, and you've been on and off antidepressants, and you've been diagnosed with either one of these three conditions, and you are a woman, please look into ADHD and see if you can get a diagnosis, because I have been struggling my whole life, and I finally have come to terms and accepted and realised what was wrong with me the entire time, and it's great.